The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
And this is session 2 of the long-term effects of whiplash injuries. And we're going to begin discussing what happens in whiplash injuries. And we want to clarify this, that you don't have to be in an auto collision to have a whiplash injuries. They come from falls and hits and all kinds of different things. And so we encourage you to call or write us or email us for session 1 if this is pertinent to you, and we're happy to get the notes or the DVD or the CDs to you. So we're going to begin now with Dr. Jensen, and we're going to ask what commonly occurs in whiplash type injuries. Dr. Jensen.
Thank you, Dr. Lala. Well, what happens in whiplash injuries is, first, I'm going to let you know my first degree to my name is I have a Bachelor's of Science in Astrophysics. So if you ever wanted to know what an astrophysicist looks like, I guess you could kind of say I look like one just because I've got the degree. But what that lets me do is to analyze these whiplashes to see what's actually happening. The first principle you might want to know is that an object at rest tends to stay at rest, and an object in motion tends to stay in motion. So when I bring up this film, we'll see where an object at rest tends to stay at rest, and an object in motion tends to stay in motion. Let's bring this, there we go. If you look at this, this car crash, see how the head stays right where it is until the car meets up with it. And so it stays right there, the car meets up with it, and then it's almost as though it gets flipped back. And there you see the glasses actually stayed where they were, and they get flipped into the back seat because they don't have something that's holding them down. And then what happens is the first reaction that we have is that we slam on the brakes, and that pushes, that in fact pushes our head forward. So that's where the whiplash action takes place. With this being unexpected, it's the duration that the impact takes place. Where you see on the bottom there, it says 4 miles per hour, the impact. And it actually accelerates the car to 5 miles per hour after the impact. And that gets even greater as the speeds go up higher. So you can see a whiplash can take place at very low speeds. It's how the duration of the force that's on the body that's really the matter here. And as we can see from this picture here, there was no damage to the car at 4 miles per hour, in which case all the damage would be in soft tissue and in damage to yourself, as well as what you need to do is look underneath the bumper of the car to see if that takes place. Here we see one that's at 9 miles per hour, and it pushes them forward at 11 miles per hour after the accident. But you can see where an object at rest tends to stay at rest until it's met up with the car. And the head just wants to stay there. That's where you really get that whiplashing motion. So here's the thing. Lots of damage can take place in that all those tissues that are in the front of the neck that are being hyper-stretched there, there's tissues that can be ripped. There's tissues that can be injured or sprained or strained that take place in there. So the injuries go much deeper than we think.
And not necessarily do they have to have symptoms, because the absence of symptoms does not necessarily indicate the internal presence of wellness.
Right.
In other words, the body excretes all kinds of chemicals when there's been a threat or trauma, right, and many times those chemicals masks symptoms.
Right, and in fact, when you're looking at soft tissue sprain, strains, kind of things like that, you have so much adrenaline going on in your body. And what adrenaline does is it shuts off pain, allowing you to continue to do what you need to do. It's in a fight or flight situation where you're fighting literally for your life. And it needs to shut off that pain that you can react.
That can be subconscious then.
That
too.
can be subconscious, and usually what they find is a lot of the pain from these things don't start to show up till maybe 5 to 10 days after the accident, where the person's really starting to feel it as their adrenaline comes down from the emotional effects of being in a car crash and the things that are attributed to it.
That's why I've learned over the years to recommend to people that even if they feel well and there's some insurance involved, some type of settlement, that they shouldn't settle anything for at least 12 months post-trauma.
Right.
So do you have some other slides that'll help people see or understand better what commonly occurs?
Right, and let's look at this, where we have the whiplash here. The forces from the rear, the head and the neck, upper and lower back, are thrust backward and then forward in a whip-like action. The spine always goes to the force and then whips forward. So it doesn't look like this is moving like it usually does, so we're just going to go on from that. What if the force is from the side? The entire body will be thrust to the side of the oncoming force, so against the door, and it's the shoulder that gets pushed first, and then all of a sudden the head goes to the side, which can result in the head hitting into the door on the side of the collision as it starts to move. Remember, it wants to stay at rest, so as that door comes closer, and then finally it gets hit, and then whips you to the other side. A lot of times, remarkably enough, these people tend to not seem like they have an injury, but internal-wise, and the insurance industries have done a lot of research on this point, where they had people that got up, they seemed fine, and then hours later, they would collapse into a coma. And really what happened was that the vasculature between the brain and the skull got torn within that, and they actually had internal bleeding. And so those are some things that you have to be aware of, that it may not be that you feel it right away, but you'll fare much better if you seek medical care right away at that point. If the force is from the front, we look at the head, neck, and upper and lower back will be thrust forward and then backward in a whip-like motion. And in fact, what we find there quite frequently, the person is injured in the ligaments that are in the top vertebrae with the neck, that you'll find that there are some problems there. And so a lot of times when you take x-rays, you have to take postural x-rays in order for these things to be seen.
And they need to be weight-bearing, standing or sitting x-rays.
Certainly.
Not the traditional where they lay you down on a table and take the x-rays, but that's horizontal, so it's taking the gravity off. And that's why a lot of things where the x-rays are made in the hospital with the patient lying down, or an MRI where they're lying down, it's fine, but you miss things. That's why sitting or standing MRIs or flat plate x-rays are the most important.
Right. Absolutely. And of course what we saw in the video is a 5 to 10 mile per hour force can cause spinal injuries. The headrest, lap, and shoulder belts, they can cause, actually, they have their own types of injuries that they cause. However, they tend to be safer from that. Less people die from the accidents, but they have particular injuries. In fact, when I take care of a couple who have been in the car, they have their shoulder belts coming from opposite sides, being whether they're the driver or the passenger. And a lot of times they have mirror-like injuries where they'll have an injury to the shoulder and the opposite hip, just how it was thrown across that shoulder strap.
Yeah, and that's why we always encourage women who have been involved in, for example, auto collisions, and they've been wearing a shoulder belt, that they need to monitor their breasts for the next several months to make sure that no tissue damage has occurred.
Certainly.
Doesn't necessarily have to show up immediately.
And those shoulder belts are a great lifesaver. There's a common fracture that was called a seat belt fracture before they had these shoulder belts, and it was a fracture that took place in the lower back because actually your ligaments are stronger than your bones. And so what would happen is as you were pushed forward, the ligaments would actually tear the bone apart and give you a seatbelt fracture in the low back when that took place. So it's very important to wear these harnesses that we're going to more and more today. And of course they can accentuate certain injuries, but you're much better in the long run. So some signs and symptoms that we have. Dr. Lau, would you like to?
Some of the most common signs and symptoms of whiplash-type injuries are neck and back pain, headaches, muscle spasm, visual problems, dizziness and lightheadedness, depression, as well as shoulder and or chest pains, numbness or tingling in the arms or hands or sometimes legs, cognitive dissonance, meaning that they are not processing or their thought processes are not as well articulated as they had prior to the trauma, short-term memory loss, fatigue, and mood swings. Now, what are we going to do? Tell me, Dr. Lala, what are we going to do? What are the usual and customary diagnostic evaluations that should be performed? Number one, standing full spine x-rays, detailed chiropractic spinal examination that includes physical, postural, orthopedic, and neurological evaluations, possible MRI or CT scan, again sitting or standing CT scan and MRIs, possibly an EMG, and nutritional evaluation. Now we're going to talk about nutritional evaluation hopefully before the program ends because there are nutritional considerations. But then, now that we've talked about standing full spine x-rays, this is an example here of the patient standing. If that patient was lying supine or prone for that matter, the curve that you see in their lower back, that sway over to the left, would be gone or absent or certainly minimal in comparison. So that's why one of the reasons we want a standing full spine x-ray. Now if we look at the next x-ray, if we're ready to move on to that, or Dr. Jensen is going to bring up he can discuss what he's bringing up there with those subluxations.
Well, right here we're showing where different subluxations can take place. You see at the bottom there where, you know, if that was the trunk of a tree and it's off to the side, it's the tree would continue off in that direction. However, we have a certain reflex in our body. It's called a writing reflex, and it doesn't mean that all of a sudden you want to sit down and write a book. It means that you want to right yourself so that your eyes are horizontal with the horizon so that you're balanced. And so what that's doing is if you look at that slide again, as it's tilted over to the left, all of a sudden you have this arch going to the right causing other subluxations there. And then it usually overcompensates, so then it's got to bend backwards. And so you finally find that all this accumulates up to the last joint, which is in the very top of the head, and that's where you can find where a lot of people get headaches from these postural problems. So that's why you really have to study the full spine to see what's going on there.
And then the next slide is a pretty good example if it is not x-rayed and properly evaluated by a doctor of chiropractic. What we see here on your screen is a picture of the lumbar spine. Dr. Jensen is highlighting that for you now. And we're seeing some vertebrae there, looking at them from the back. Now the arrow on your far right, looking at the right, is indicating there that over a period of years, because the vertebrae were out of alignment originally from the accident, they stayed out of alignment, and what the body did in a defense mechanism, it started to grow extra bone on the outside of the vertebra, and it's called, radiologists call that spondylosis. A simple term for it is spinal arthritis. If we go up to the arrow on the left, we're seeing here a shadow of the disc. It is very narrow and wedged there like a doorstop. We also see those gray things there. That's the spondylosis that's being pointed out. Now Dr. Jensen is outlining the disc. It is very narrow there by the arrow, but as we move over with the arrow to the right, it is very large and is more normal size. So the disc is being wedged, and that disc is degenerating away there. Dr. Jensen, do you have anything to add to that?
Well, now what you were talking about is there's actually ligaments that come around here, and what you see is that there's inflammation that takes place because of abnormal joint motion. And in order to help the body, what it does is it starts to shore that up to bring some more stability to it. And so the calcium starts to form around those ligaments, sealing between these two so that you'll no longer have motion between it. And so what we try to do in chiropractic is to maintain that motion in a normal way so that that inflammation goes down and so that you can heal.
Mm-hmm. Now we can leave that there for a second. If, for example, the person chose not to go to a chiropractor but went to a massage therapist, or it could be a physical therapist, hey, that might be nice to have your back muscles rubbed, That's not going to put those bones back in alignment. It's not going to put those discs back in alignment. It's not going to impinge those nerves, arteries, or veins. So as good and potentially good as massage therapy or physical therapy might be in some limited situations, it can't compare to what chiropractic adjustments to the spinal column can do. So, but if you put myofascial release or neuromuscular reeducation, which is a scientific approach that is way beyond what physical therapy or massage therapy is, then you're enhancing the potentiality of correcting those problems early on and thus minimizing or eliminating chronic problems. Now, Dr. Jensen has in front of you a wonderful anatomy slide that it talks about these structures in more detail. Dr. Jensen?
Certainly, around all these bones that you see here, we have ligaments there that help keep these bones in alignment. And whenever you see that these bones are out of alignment, that means that there's been damage to some of these ligaments. Now, those ligaments can be certainly torn and therefore create a weak spot in that area and a predisposition for that segment to be out. Or they could be sprained in there, and again, it's a stretch that has taken place. These ligaments are highly innervative for pain, and therefore what happens is they become a source of strong pain within these people. And it behooves us to put these back in position so that those ligaments are under the least amount of stress, can heal in their proper alignment so that they can be strengthened there.
They're going to have to be manipulated by a chiropractor to get them in back proper alignment.
Right.
How about if we look at some MRIs of the spine?
Well, here we have an MRI evaluation that's taking place, and it's important because an MRI, what that does is it allows us to see the soft tissue around there. We have hints at it, and we've talked about those hints from a pure X-ray perspective.
Now, is this of the lumbar spine?
This is of the lumbar spine right here.
The lower back?
Of the lower back. And so what we're looking at here is there's actually a different weighted MRIs. There's a T1 and a T2 weighted MRI. This is a T1 weighted MRI, which allows us to see fat much better. So those are the areas that have a lot more white associated to them. So on the outside, you know, if you're looking at the spinal cord, you can see that that's pretty bright. You can see in the bones are pretty bright. You can see the skin is pretty bright. So we're looking at the fat along with this. But what we're seeing here that's circled here is actually where we have bulges of those ligaments that are going into the spinal canal, and therefore can show where there's areas of pain, of certainly a beginning of disc degeneration, and hopefully that it's not pushing against these nerves causing radiculopathy that can go down into the legs. Mm-hmm. Okay, and so next slide that we look at here is really we're going to show some images that show changes in the magnitude of an L5-S1 disc herniation with flexion and extension. So we're looking at postural changes under an MRI to see what has occurred.
And the L5-S1 is the fifth lumbar, the last vertebra in the spine. The sacrum is that triangular shaped bone that's wedged between our two ilium.
Definitely. And so what we're looking at here is down at L5. The sacrum still looks like it's segments, but really this is all fused together in here, and that this is the first lumbar vertebrae here. And if you look at it, here they actually have a hypolordosis here, kind of a curving. They're trying to help themselves, and then by postural changes, and then with a normal posture with extension. Here they're in a little bit of flexion, bending forward. Here they're actually bending backward, and you see where this herniation is much more resolved, that you can see it, as opposed to here, where this is kind of being stretched. So there's a difference there, and we can look at that also again. Here's a flexion and extension view of that. Again, you can see where this herniation is a little bit more stretched out here, but then again you can see where it's pouching back into the spinal canal in this one with extension. So sometimes these views can allow us to see with much greater resolution and better determination of the soft tissue injuries
and again,
that have occurred.
You're getting a much different picture with a standing MRI than you are with one that's recumbent, where the
Oh,
patient's laying
definitely,
down.
definitely, because there's no stress on it. There's no pulling downward gravity. And a lot of times what they used to do is in surgeries, these people, of course, are lying down in surgery, and the doctor goes in there and he says, well, we know the injury is supposed to be at this spot. However, I don't see the mechanism of pain in this way. When you take the MRIs in this case, underneath the weight of gravity, it reproduces where they're feeling the pain, and therefore they can see the mechanism of injury and see what needs to be done in that case.
And in many respects, the orthopedic surgeon, during surgery, that's static,
Right.
whereas a chiropractor is functional
Right.
movement. Okay.
Right.
What's the next one?
The next one here is we're looking at what can take place in the cervical spine, where images show only minimal disc herniation at C5, C6, that's at the bottom of the neck again, on a neutral upright picture from the side, and it becomes inconspicuous when the person flexes their head forward, and on extension you can see it much more prominent. So we'll take a look at this here, where this is more neutral. So you're seeing it down in here somewhat, but it's not as prominent as you might see it on a flexion and extension. Here on flexion, where they're bending their head forward, putting their chin to their chest, it's non-existent, really. You really don't see it. It's probably right about here, but you really don't see it as well as you would hope to. And then on extension, boy, you see not only that one bulge out, but you can see that there's actually an injury on the one below.
So the top would be up at the brain stem and the
This
base
is
of
where
skull.
the brain stem is. From here, you're actually seeing the Abdullah oblongata here, which is a technical term for the brain stem. And as we come down the spinal cord,
Because being pinched off down there.
being pinched down about C6, C5, 6, and C6, 7. And you're going to feel that out into your arms if it's radiating. But definitely that's highly innervative for pain in that area because of the ligaments. So
How about some of the increased demand for nutrition? We wanted to spend a few moments with you on that. Even though currently it is my impression that most insurance companies would not pay for any nutraceuticals or any nutrition. They'd probably reimburse for drugs. But isn't it interesting, when it's inexpensive and it's natural, they don't pay. But you might want to consider, if you've had been involved in a whiplash type injury, regardless of the method or the mode that it came through, you might want to consider incorporating in your diet a good broad spectrum amino acid, a good vitamin C, preferably the ester C variety, some iron if you're still in premenstrual, if you're still in the menstrual phases of life, if you're postmenopausal. We discourage you from, regardless if you've been injured or not, of minimizing your iron intake, because there's considerable evidence in society that, or research that shows that people who have higher levels of iron postmenopausal are more prone to stroke, both males and females. Do you have something to add to that, Dr. Jensen?
well, I'm looking at these healing nutrition over here with the amino acids. You have to look at that these tissues are going to need the basic building blocks in order to recreate that for healing. And so when Dr. Lal is looking at telling you getting a broad spectrum amino acid supplement, he's really looking to make sure that you have the building blocks to build good collagen. And then vitamin C and iron and alpha-ketoglutarate are very important nutrients to help create that collagen in there. And really, collagen is connective tissue. And to show you the importance of connective tissue, we have so much connective tissue in our body that if I remove all other tissues in the body, you would still be able to recognize the person purely from their connective tissue, which is basically the collagen. Then homeopathics. Dr. Lala, would you like to continue with that? Or?
Because there are often internal bleeding that we're not even aware of. There are specific homeopathic remedies for blood clots, congestion of blood, traumatic injuries. Certainly might want to consider avoiding caffeine and menthols, which interfere with the effectiveness of homeopathic remedies. And then We could also look at increasing the demand of nutrition for proteolytic enzymes. Maybe Dr. Jensen would like to finish up with those.
Certainly, Dr. Lala. Well, we're looking at inflammation. Proteolytic enzymes are used to break down those things that are causing inflammation in our body. It's through it's the same thing that makes, say, raisins fill up and become more like grape-like when you put them in water. It's due to the proteins inside. So you use the proteolytic enzymes, but it's when you take them that is also important, because if you take them with food, they just work as a digestive enzyme. If you take it between meals, then it helps to bring down inflammation. Bioflavonoids and herbals are real good at bringing down inflammation. Essential fatty acids help fight against that signal that can perpetuate inflammation. And inflammation signal inhibitors are also there. Debris cleaning or clearing would be found in taking calcium and vitamin E and zinc, copper and manganese. They all help to remove the debris of that resulted from the injury. So as well as, get rid of free radicals and things like that that are caused by the immune system within that also. And Dr. Lala, some final
we could do a little bit of final thoughts. Certainly, we're doctors of chiropractic, and we certainly encourage you to seek the services of a chiropractic physician, and make sure that the best way to find one of those is through referral, because somebody who's been to he or she knows if they're thorough or if they're not thorough, if they take x-rays or not x-rays, if they are concerned about you, if they lay out a treatment plan that includes exercise, maybe physical therapy, maybe some form of muscle rehabilitation therapy, as we've mentioned, a scientific approach to massage, which would be, a couple examples would be myofascial release and neuromuscular reeducation. Certainly acupuncture is a valid approach to treating any and most health problems, as well as people who have been involved in whiplash type injuries. And so don't let anybody, in my opinion, and I know Dr. Jensen agrees with that, don't let anybody work on your spine without a thorough examination, without spinal x-rays. They're so clear and they're good quality. Go to somebody who has a professional-looking practice, somebody who has a good reputation in the community, and interestingly, a good reputation with insurance companies. Doesn't mean that they're buddy-buddy with the insurance companies, but insurance company knows the good chiropractors, knows the good medical doctors, knows the good dentists. They know based on the records and the type of record keeping that those doctors maintain, the type of reports they send. They know the good ones in that, and certainly they can't send you to somebody. But again, a lot of it depends on the kind of reputation that the doctor has, and that how the insurance company is going to treat your claim. Believe me. Now, there's some insurance companies that just are going to cut you off right away. That's their problem, and that says, hey, that's not fair, and you need a good legal advice, and again, a professional attorney who is experienced in auto collision industries, not some attorney that's going to just settle your case real quick and make some money for you real quick. But you don't want to settle these cases in less than a year after post-injury, really. And why would we say that? Because it's the truth, and because we want to talk to you just as if you were Jesus Christ right here now. Because if we do unto others as we'd have others do unto us, then you're going to get the best possible care. And you don't want to go to somebody who's going to recommend treatment based on financial ability to pay, but rather on what you need, and that's going to be upfront and honest with you. So remember, God wants you to have long life and good health. He does. He wants you to have a good medical, chiropractic, and dental care. He really does. So take good care of your health. Take good care of your health.
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, thank you for listening to House Call.